Hello. I am Kim Kyung-won. It's a pleasure to meet you via online surgery session. I'm going to give you a brief description of today's surgical case, and then we'll go through the surgical video. This is a panoramic X-ray of a 73-year-old male patient on his first visit. The second molars on both sides of the mandible, number 37 and number 47, were missing. The chief complaint was pain and severe mobility in number 16 on the right side. The patient wanted to have number 16 tooth extracted. However, the periapical area had multiple lesions and significant alveolar bone destruction. So the surgical plan was to extract number 16 and perform socket preservation using A-Oss Collagen at this area. Then, after waiting about 4 to 5 months, I plan to perform a crestal approach with OneCAS KIT and simultaneous implant placement with bone grafting. During follow-up after the extraction of number 16, the patient complained of severe pain at number 25. Although there is no surgical video for that, I performed immediate implantation after extraction and used A-Oss for the bone graft in the gap. Ultimately, implants were placed in number 37 and number 47 at the time of implant placement in number 16. Here is the CT for number 16 at the initial visit. As you can see, the alveolar bone is extensively destroyed on the apex. Fortunately, there was some remaining bone on the buccal and palatal sides, which allowed me to predict better outcome with socket preservation. This shows the condition at the time of tooth extraction. After removing the crown, the tooth was sectioned into 3 parts, mesial and distal roots on the buccal side and the last one on the palatal side. This is to minimize trauma and preserve surrounding bone. As you can see, there is quite a bit of granulation tissue inside the extraction socket. I removed all granulation tissue and performed socket preservation using A-Oss Collagen, followed by suturing. A hidden X suture was applied. In this case, I only used A-Oss Collagen without a collagen membrane. I have been comparing cases with and without collagen membrane. Given my recent experiences, I think that using a collagen membrane is favorable in getting desired results. In this case though, there was still a little bit of residual bone on both the buccal and palatal sides. Thus, socket preservation was performed without the membrane. Now, you can see panoramic X-ray image after socket preservation and the immediate postoperative cone beam CT image. You can see that I performed socket preservation on the extraction site using A-Oss Collagen. As I explained earlier, the patient complained of severe pain in number 25 during the follow-up. So I checked the CT again that day, and as you can see, I performed tooth extraction and then immediate implantation without one guide. I placed an implant at site number 25. For the gap between the buccal and palatal areas, bovine bone, A-Oss was grafted inside the socket, and S-MAM was used to cover the site. And then I let it go through secondary intention. This is the immediate postoperative image showing implantation on number 25. Actually, the extraction socket was quite large, so the ISQ value was about 39, which was quite low. Therefore, instead of placing a healing abutment, I placed a cover screw and performed a bone graft over the area, then left it as it is. This is the immediate postoperative condition of the site number 25. As you can see, the implant was successfully placed. An intrasocket grafting was done using A-Oss to address the bone defect on the buccal and palatal sides of the implant. This is 1 month after the surgery on number 25. And this is a panoramic X-ray taken 3 months after the socket preservation on number 16 on the right side. This is a cone beam CT about 4.5 months after socket preservation with A-Oss Collagen at site number 16. It seems the condition after socket preservation has remained quite good. The distance to the sinus floor was estimated to be more than 6 to 7 millimeters, which was sufficient. Site number 37 and number 47 were expected to be suitable for implant placement without any issues. I've consulted the OneGuide team to come up with a surgical plan, and as you can see, in number 16, the lowest area to the inferior margin of the maxillary sinus is about 6.95, almost 7 millimeters. But to play it safe, I was thinking about starting from 5 millimeters with the assumption of 6 millimeters. My expectation was that the highest point at the floor was slightly above 8 millimeters. So the residual alveolar bone height was around 8 millimeters. As opposed to our initial thought, this case looked promising for implant placement even without sinus bone grafting. That is how I planned the surgery. Regarding the drilling sequence at site number 16, I began with a 5 mm initial drilling with the assumption of 6 mm. I used a twist drill with the diameter of 2.2 and the length of 7 mm with a 2 mm stopper. For the final diameter, I plan to drill up to 3.8 mm. As you will see in the surgical video, with drilling up to about 8 mm, the sinus floor was not fully penetrated, so I actually drilled up to 9 mm. After a slight hydraulic sinus lift, I thought that it would be enough to proceed to the next step without bone grafting. So I placed an 8.5 mm implant immediately. As for site number 37 and number 47, since these were already extracted areas, I plan to place two TS3BA implants with the diameter of 5.0 and the length of 8.5 millimeters. This is the immediate post-operative condition. Looking at site number 16, although we did not additionally perform bone grafting inside the sinus, the apex of the implant slightly opened the sinus floor. For number 37 and number 47, implants were simultaneously placed. The prosthesis was already seated for number 25 at that time. If you look at site number 16, the apex of implant is slightly penetrating the sinus floor. Thus, without additional bone grafting, I elevated membrane only a little bit and placed an implant immediately. It was possible thanks to the previously well-maintained socket preservation. The ISQ value was not that high, around 59. For site number 37, the implant was well placed as planned with ISQ values of 82 and 78. For site number 47, which was extracted not long ago, ISQ values were 63 and 70, also indicating successful placement. Here is the condition 2 months after the surgery. This is a panoramic X-ray taken 2 months later and the final prostheses have been seated. Here is a panoramic X-ray with the final prostheses placed. As you can see, although I did not perform any additional bone grafting at the apex area of site number 16, bone seems to have formed up to the apex level along the sinus floor. Next, for site number 25, as I explained before, I did immediate implant placement and A-Oss grafting in the gap, so you can see that the buccal and palatal sides are well preserved. Final prostheses were also placed at both sites, number 37 and number 47. Let's check it all through the surgical video. To begin with the mandible, I am adapting the OneGuide template to the mandibular arch. After adaptation of the OneGuide template, I will remove the overlying mucosa by using tissue punch. For site number 37 first and then number 47, I will use tissue punch to remove the overlying mucosa. I am going to remove the OneGuide template and double check to make sure that the soft tissue is completely removed. Again, I am going to adapt the OneGuide template properly in the mandible. And then with the flattening drill, I will flatten the bone above the site number 37. I need to make sure that the drill should go all the way to the stopper. That is for number 37 and then for number 47. Up to the stopper. Now to the next step of initial drilling. I perform initial drilling on number 37 and also on number 47. This is a 8.5 mm long, f3.5 one-guide drill. Drilling begins at site number 37. Then, drilling also at number 47 with pumping action to the depth of 8.5 mm. And then, I will start with a 8.5 mm long, f4.5 drill just in case. First on site number 37 and then site number 47. Then moving on to a 8.5 mm long, f5.0 drill. I place an implant about 70 to 80% on number 37 with the engine. Next is final positioning with the implant driver and torque wrench. It reads about 30 Newton-centimeter. Final hexagonal positioning is completed. For site number 47, I will place a 5.0 mm wide and 8.5 mm long implant. Since this site was more recently extracted, primary stability here is slightly lower. So placement up to about 70 to 80% with the engine and then with the hand wrench. Initial torque should be about 15 to 20 Newton-centimeter, I guess. It is about 15 Newton-centimeter. A little over 10 Newton-centimeter. Implant positioning is now completed for the mandible. Let's take a look at the ISQ values. For site number 37, ISQ values are 82 and 78, which are quite stable. For site number 47, the ISQ values are 63 and 70, indicating slightly lower stability compared to the opposite side. Healing abutments will be placed on both sides of the mandible. After completing the placement of healing abutments, I will apply OneGuide template to the maxilla. The OneGuide template fits well. I am going to take the tissue punch and remove the overlying mucosa at site number 16. After removing the gingiva, I will flatten the bone surface using the flattening drill. I will begin with a 2.2 mm wide and 7 mm long OneCAS drill with a 2 mm stopper, which means drilling up to 5 mm first for safety. I can start with drilling up to 6 mm, but I will begin at 5 mm. Then, a 2.8 mm wide and 7 mm long OneCAS drill with a 2 mm stopper. Next, I will move on to a 3.8 mm diameter drill at 7 mm length with a 2 mm stopper. Drilling up to 5 mm. 3.8 mm will be the final diameter. So the gap with the finally placed implant of 5 mm will be 1.2 mm. Then, I will drill up to 6 mm using a 1 mm stopper. With 6 mm depth, it probably wouldn't penetrate the maxillary sinus at all yet. I will use the depth gauge to check. You can see that the sinus floor has not been penetrated. Now I will proceed with a 3.8 mm OneCAS drill at 7 mm length without a stopper. When measuring by the depth gauge of 10 mm with a 3 mm stopper, thus up to 7 mm, you can see that the sinus floor has not opened and the stopper is not in contact with the template. I will now drill up to 8 mm by attaching a 2 mm stopper to a 10 mm long drill. After drilling up to 8 mm, I will check with the depth gauge with a 2 mm stopper to measure the 8 mm depth. It shows that the sinus floor has not been completely penetrated yet. There might be a bit of perforation, but mostly intact, thus I will go with drilling up to 9 mm. Then I will use a 10 mm drill with a 1 mm stopper to drill up to 9 mm. At this point, I can slightly feel the sinus floor being penetrated. I am going to attach a 1 mm stopper to the depth gauge to measure 9 mm. You can now see the stopper contacting the template, meaning that the sinus floor has been penetrated. Now, I will proceed with a slight hydraulic sinus lift. Bone grafting is not needed here. I will do the hydraulic lifting, not much but a little bit. With about 0.5 cc, I will slightly detach the sinus floor. And given that bone grafting is not needed at this level, I will place an implant with the diameter of 5.0 mm and the length of 8.5 mm after hydration. It would be like the implant apex slightly touching the bottom of the sinus floor. I will use torque wrench now to finally position it. It's almost 30 Newton-centimeter. The hexagonal position is properly aligned. Now let's check the ISQ. It reads 59. It is because the implant is mainly placed in an area where I applied socket preservation, thereby resulting in slightly low values of ISQ. That is the end of the surgery. In this case, the residual alveolar bone height was about 7 to 8 mm, so I used OneCAS KIT. As the apex of implant just contacted the lower edge of the sinus floor, I went ahead with implant placement with OneCAS KIT by taking advantage of the existing socket preservation area without bone grafting. Thank you for watching.